The main joints and articulations being utilized are as follows: scapulothoracic joint, acromioclavicular joint, sternoclavicular joint, glenohumeral joint, radial ulnar joint, humeral ulnar joint, radiocarpal joint, MTP joint, PIP joint, DIP joint, CMC joint, IP joint, acetabulofemoral joint, tibiofemoral joint, talocrural joint, distal tibiofibular joint, subtalar joint, midfoot tarsal joints, and tarsometatarsal joints. Scapulothoracic joint, articulating bones, scapula and thoracic rib cage. Not a true synovial joint, but does have some joint characteristics and is supported greatly by its muscles, serratus anterior and subscapularis. Acromioclavicular joint, articulating bones, acromion process of scapula and clavicle. Synovial plane joint, only way the scapula is attached to the rest of the body and is supported by its ligaments. Coricoclavicular, superior acromioclavicular, inferior acromioclavicular ligaments. Sternoclavicular joint, articulating bones, sternum and clavicle. Synovial double plane multiaxial joint, supported by stabilizing tissue such as the anterior and posterior sternoclavicular ligaments and separated by an articular disc. The glenohumeral joint, articulating bones, glenoid fossa of scapula and the humerus. Ball and socket synovial joint, supported by rotator cuff muscles and capsular ligaments that blend into fibrous capsule. Radial ulnar joint, articulating bones are the radius and the ulna. It's a pivot joint. Humeral ulnar joint, articulating bones, humerus and ulna. Hinge type joint allows for more stability when fully extended and reinforced by ligaments. The radiocarpal joint, articulating bones, radius and carpal bones of proximal row, scaphoid, trichotrom, and lunate. Condyloid joint allows for ulnar and radial deviation along with flexion and extension. The MTP, PIP, DIP, CMC, and IP joint of the hand, articulating bones, metacarpals, and phalanges, / carpals and metacarpals. Hinge joint except CMC, which is a saddle joint. The acetabulofemoral joint, articulating bones, acetabulum of the hip, and ilium, ischium, pubis, and femur. Ball and socket synovial joint relatively stable due to bony architecture, strong ligaments, and large muscles. The Y ligament or iliofemoral ligament is one of the strongest in the body. Tibiofemoral joint, articulating bones, tibia, femur, and patella. Synovial hinge joint supported mainly by its large muscles and ligaments such as the PCL, ACL, MCL, and LCL. Talocrural joint, articulating bones, talus, tibia, and fibula. Synovial hinge joint supported by its collateral ligaments. Main ligament on the medial side is the deltoid ligament. Distal tibiofibular joint, articulating bones, tibia and fibula. Plain joint with minimal movement due to ligaments and strong interosseous membrane. Subtalar joint, articulating bones, talus and calcaneus. Plain synovial joint held tightly by its interosseous ligaments. Midfoot tarsal joints, articulating bones, 3 cuneiforms, navicular and cuboid. Plain synovial joint. MTP, DIP, PIP, and IP joints of the foot, articulating bones, metatarsals, and phalanges. It's a saddle joint. Next, we'll move into the breakdown of muscles in action by phase used in the 40-yard sprint. First phase is the stance phase. All the muscles in the stance phase are in an isometric contraction. The stance phase all takes place in the sagittal plane and frontal axis. The main agonistic muscles being recruited are the hamstring muscles on the right and left sides of the body, and the core muscles for stability and maintaining that stance. The main core muscles are the transverse abdominis. Many other muscles are utilized in this phase as well, which are all shown in the diagram as follows.
Because the 40-yard dash is a constant forward motion, all of the actions, excluding the abdomen, take place in the sagittal plane and the frontal axis. This chart is based off of the right foot being the foot to push off the ground, basically the leg that is pushing off and extending. As you can see, each movement has the ability to be concentric and eccentric. In eccentric motion, tension increases on the muscle as it lengthens. In concentric motion, tension increases on the muscle as it shortens. Because the 40-yard dash involves both legs consistently moving forward, all of the muscles will switch from concentric to eccentric depending on where the leg is in motion. An example would be that when you are lifting your leg to move forward, your hip flexor muscles are concentrically contracting, while the hip extensor muscles are eccentrically contracting. The main muscles being used in the preparatory phase are bolded, so essentially the quadriceps, the hamstrings, and the foot extensors. The preparatory phase also takes place in the sagittal plane and the frontal axis. Once the body becomes upright, the preparatory phase is over and the action phase begins. In the action phase, as you can see, each movement has the ability to be concentric and eccentric in this motion as well. The muscles also have the ability to be agonists and antagonists depending on which muscle is contracting. An example would be that when you're lifting your leg forward, your knee extensor muscles are agonists, while your knee flexor muscles are antagonists. The main muscles being used are bolded above, so essentially the hamstrings, the quadriceps, the hip extensors and flexors, and the foot extensors and flexors. This phase also takes place in the sagittal plane and the frontal axis.
The last and final phase is the follow-through phase. The main muscles being used are the hamstrings, which help cause the body to decelerate. As you can see, deceleration happens when the hip and knee are flexed. Decelerating with the knee or hip extended can cause injury. All lower body muscles will be eccentrically contracting due to the body needing to slow down. The last and final phase also occurs in the sagittal plane and the frontal axis.
All in all, the 40-yard dash involves knee extension, knee flexion, hip extension, hip flexion, plantar flexion, elbow flexion, and posture and stability. All of these muscles and joints must work together in order to create the perfect sprint.